Welcome everybody to GoLocal Live. I'm Josh Fenton, CEO and co-founder of GoLocal. With me is Dr. Michael Fine, formerly the health director for the state of Rhode Island. And Dr. Fine, thanks for joining us again today. I think it's been wildly well received, your appearances and your expertise. Let's start with talking about the numbers. Where are we in the world, in America, in Rhode Island right now?
Well, the numbers are increasing. The numbers that I have as recently as about 10:30 this morning from around the world, not necessarily from Rhode Island, are in the world there are now 137,000 cases. In the United States there are now 1,701 cases, which is a jump of almost 1,000 in the last 24 hours. And in Rhode Island, we've had 5 cases for the past few days. We haven't heard the report from the Department of Health yet. It wouldn't shock me if that changes. In Rhode Island, we have tested about 150 people and have gotten about 275 people to self-quarantine. So the numbers are going up, and what we don't have a clear answer on yet is whether there's evidence of community spread in Rhode Island. And part of the reason we don't have that evidence is we're not doing all that much testing.
Right. And obviously in those places that are seeing testing, are seeing more cases. Steve Peoples, who used to be at the Providence Journal, is now at the Associated Press and freelance for GoLocal early in our career, is now the White House, I believe, correspondent for the Associated Press. He outlines in a tweet today the difficulties of finding a test and being referred from place to place to place with no satisfaction. Are we in a little bit better shape on being able to do any testing here in Rhode Island?
You know, I think we're in the moment of change. The White House promised on March 6th that everybody would have access to testing. That was over a week ago. What we know is that CDC released 75,000 tests on March 7th. I don't know how many came to Rhode Island, but if you figure it out proportionately, how many we were likely to have based on our population, we were going to have about 225 or 250 tests. That was all that I expect were likely to be allotted to us. Now maybe we got some more, but I don't think we got much more than that. The big numbers of tests will be available next week, we hope, but those big numbers are not available yet. At the present time, as I understand it, Lifespan and Eastside Lab are sending all their tests to the Rhode Island Department of Health, and there's only one commercial lab that has made the test available, but it's not clear whether it's really available in Rhode Island or just that lab says it's available.
Now, walk through a person's feeling like they've got some symptoms, and they're not severe. They may feel like, oh, it just could be seasonal, it could be the coronavirus, and they don't get tested, but they do self-quarantine. That number will never come up in any count.
That's exactly right. And that's actually the safe thing for people to do right at the moment if they're not feeling that particularly ill. You know, there's no real advantage in going to your doctor's office right now because your doctor doesn't really have very much to do for you. There's no treatment for this and no vaccine. You know, if you have mild symptoms, a low-grade temperature, you know, a dry cough or the sniffles, that's a perfect time to stay home and stay home until you're better.
The implications of this virus on the states as well as the nation and the globe's economy obviously always has to be balanced. What, you know, for a small business owner, somebody who owns a restaurant and has 15 employees, what's your recommendation to them?
Oh, I think to prepare for a 2 to 4 month problem of much reduced economic activity. I think we've got to expect that this isn't going away tomorrow. If you look at the time duration from China, they've been at it for 2 months. They haven't opened up yet. And I think it's going to take 2 to 4 months before we see the peak. I've heard some predictions that the peak is likely to be toward the end of April, and that's just the peak because then we've got to be able to get things slowed down again before we open up. So I think everybody should be prepared economically for a pretty long period of quiet and make the changes that they can make to survive this financially. At the same time, it's pretty clear to me that the state and the nation should be making really robust accommodations to support people economically during this time, support people in their communities, particularly low-income people who are going to get hurt worse in this, need various kinds of support. Small businesses need support to survive it, and then maybe some of the big businesses, they're likely to be asking for support early. I think we should be supporting people in communities first.
Mental health is going to become an issue. People are going to be separated from their family and their friends for a very long period of time in a very unusual way. While the Great Recession might have been economically different, we didn't separate socially. 9/11 actually potentially brought us together in unique ways. How should people begin to work through that? And is the infrastructure of our mental health fiber ready to deal with this issue as well?
Well, I think it's an issue I have not heard widely discussed and is really critical. This thing that's happening is the source of much anxiety and will be destabilizing for people with underlying mental health issues. We don't really have an infrastructure highly developed that helps people sort things through telephonically. So we don't have a big tradition of people doing counseling over the phone. And it's pretty clear to me that our folks who do mental health work, this is an opportunity to support them as they develop that telephonic capacity, because it's going to be critical. And then I think we all need to learn the process of reaching out to each other and talking to each other a lot by telephone. We have all these new fancy technological tools. This is the moment to use them, and this is the moment for people to be in touch and be together as communities. If we have to do it by voice or email, that's better than nothing. It's probably not as good as being in person, but at this moment, being in person isn't wise. This is the moment to be talking to your friends and family many times a day and reaching out to and being in touch with everybody you know.
Technology is so advanced today that we can even get a doctor in Situate, Rhode Island, to Skype into a newsroom in Providence, Rhode Island. We ought to be able to find some strategies to be able to connect people in new and innovative ways. And speaking to that, this is going to reinvent things like medicine, isn't it? That there will be new ways to adapt technology to expand the reach of the healthcare infrastructure.
That's exactly right. This is the moment for us to redesign the primary care delivery system, for example. I mean, to understand that we don't have enough primary care doctors to make sure we get more, but also to challenge primary care practices and community health centers to start to do as much as they can telephonically or across Skype, but also to support them by changing their business model. We've relied on this old fee-for-service system that really doesn't work. This is the moment to move practices and community health centers to what's called capitation, to pay them per person per month for taking care of people. And actually, this is a place where the federal and state government can really lead by pushing hard on that transition and getting it done soon, so that practices don't go out of business as they're trying to take care of people. There is a real danger for practices in community health centers when fewer people come through their doors, that they're going to get into financial trouble just because they've relied on people coming through their doors as the only way they get paid. We've been needing to change that for the last 20 years. This is the time to get it done.
I think there's going to be a lot of innovation in a lot of different structures. Let's just go back to the governor's press conference today at 1 o'clock. She's had press conferences a number of times this week, but they've generally been about significant issues. She's not just having press briefings for the purposes of press briefings. Our expectation is to hear that there is a growth in the number of presumptive cases and other updates. What do you think it's most important for her to communicate now? I think she's done a good job telling people not to gather in large groups, and she seems to be poised to potentially closing the schools around the state.
Well, I think the most important thing for us all to say is that this is a disease most of us will get, that it's nothing to be afraid of. Most of it's mild disease, and we need to take it one day at a time and be thoughtful. To say that over and over again is important, and also to remind everybody what an amazingly good job Rhode Islanders are doing at being thoughtful already, at shrinking public events, at doing what we can do over the phone or over the internet. People are doing a spectacular job watching out for each other, and I think it's worth commenting on that, commending people for doing that, and encouraging that we keep doing it going forward.
Dr. Fine, I think that's an excellent point. There is a strike of irony that the leaders in drawing attention to ending the large group gatherings has been professional and college sports. They were really first and in the forefront over the past 48 hours in saying it is critical for people to give large gatherings a break for a period of time.
And you got to give them a lot of credit. I mean, I think their action in that regard has made this real to many Americans who may not have been paying much attention to it yet. It's been a huge help. But not only has I've seen this happening not only at that level, I've seen it happening all across the state. Right. Everybody is thinking critically about what they're doing, and it looks like everybody's acting fast. And when you really understand it, what people are doing are really acting to protect somebody else. This is not about protecting me because everybody's going to get this disease. Right. This is about protecting the people who are frail and elderly and at most at risk. That's what we're doing when we move things offline. And people have just really risen to this challenge and have done a fantastic job.
Dr. Michael Fine, thank you so much. As a programming note, I'll be back at 2 p.m. with Jean Lesser, a French journalist, former editor of France 24. He'll be talking about implications in what's going on in Europe, Italy, France, the economic conditions of the continent, and the relationship between Europe and the United States, especially as it relates to the travel ban. Thanks everybody for tuning in. We'll be back at 1 o'clock with a live feed of the governor's press conference and back at 2 o'clock with Jean Lesser. Thanks everyone.